Hey everybody. So I'm going to be presenting on iodine. My name's Emily Reyes. So let's get started. So first off, iodine is a mineral. It's a chemical element that's found on the periodic table. It's part of the halogen group. It's not very abundant, and that actually works out because we don't need too much of it inside of our body over the period of our lifetimes. It's very little the amount that we need, but we do need it because it is an essential nutrient. Our body does not make it, but for proper thyroid function and for proper growth and development, it is necessary that we have iodine. And so it's mostly found in areas at sea level. And so it's found naturally in foods, the soils, and very little in the ocean. So, how much iodine is needed? Um, most, as you can see from the graphs, the charts on the side, um, it is most needed during pregnancy, when mothers breastfeed, and also in young infancy. We'll go over that a little bit in the next slide, but from the side, these charts right here, you can see that there's no upper limit yet established from birth to 12 months. But the upper limit kind of depends on your age group. So adults, they can have no more than 1,100 micrograms. And then the recommended amount um, from, so the reason why I said that the iodine is most needed in a lot of the life, in a few life stages is because on the side we can see that from birth to 6 months, and then also from 7 to 12 months. So young infancy is when kids need it most, and then from 1 to 8 years, it kind of drops off. And then as children are growing and become adults, then it starts to increase. But for pregnant women and breastfeeding women, you can see that it's high. And so it's important for breastfeeding mothers to increase the amount of iodine just because they need it for themselves and also for their growing baby. Okay, so iodine's function in the body. It is very important for metabolism, and that has a lot to do with its role that it helps for the thyroid. Um, it is used for the metabolism in that it creates and synthesizes hormones, and then also for the infants, it helps with bone and brain development in infancy. And so in the early um, 20th century, we saw that one of the leading cause of mental retardation was because of low iodine levels. So iodine in food. Some some foods that we can are pretty high that are pretty high in iodine, or where we're most likely to find it, is in seafood, um, especially fish such as cod, shrimp, and just other um, crustaceans. Also kelp, so seaweed, anything like nori, um, is also very high in iodine. The next would be dairy products, and that's actually because of dairy products, but that's very specific to the United States because of a our process that we use to milk the cows. One of the products that farmers use actually has iodine on it, so we actually receive iodine from that product that they use. The next would be fruits and vegetables, but this is very specific to areas that um, are at sea level and have very iodine rich soil. So if a, this would not be applicable to areas in the Northwest, Michigan, and the Appalachian Mountains. And we'll go over that a little bit later. And the next would be iodized salt, which is table salt. It's very common, but something that we should also be aware of is that a lot of manufactured foods, such as canned soups, they don't actually have iodized salt inside of them. So for it's important to get our iodized salt from the table salt that we might add to our vegetables or to our meats. So deficiency versus toxicity. Um, there are some similarities between the two of these. The two similarities would actually be goiter and the inflammation of the thyroid. So goiter is an abnormal enlargement of the thyroid, and so in both deficiency and toxicity, we can see that. So a deficiency in fetal and infant development has a lot to do with the brain and how it develops. It also with a deficiency in infants that we can see a stunted growth and also a delayed um, sexual development, and then also cognitive function during childhood when children have a mild deficiency. We're able to see lower IQs in these children, and then fibrocystic breast disease. This is one that is not doesn't have a lot of studies on, but they believe that deficiency actually causes cysts in the breast. They're malignant, but